to our Q&A corner. Today we'd like to discuss hypermobility. So you see hypermobility in all different types of people. Specifically, we see it more in females, especially younger through teenage years, where everything's growing and stretching, and then throughout life, giving birth, all that sort of thing can really impact the ligaments throughout the body. Specifically, you see it in ligaments in the pelvis, ligaments in the shoulder. They can become loose, and if you're not doing any core stabilizing exercises, really keeping yourself contained, then it allows the body to just hang joints and bones off each other, and the ligaments get long and damaged, and sometimes they can even tear. Ligaments generally tend to take anywhere between 6 months to a few years to heal and come back together, depending on how severely torn they are or how stretched they are as well. They also can get inflamed, which can lead to all levels of discomfort, and it can be quite a deep sort of a bone pain. So if you have a pain in your body that's been really persistent for a long time in a joint or something, and you're not quite sure what it could be, it could very well be some ligament strain. So we're here to talk today about exercises you can do to bring stability into your body and to help this ligament along with its process of healing. Tracy?
Think of your ligaments like an elastic in an old pair of underpants. When the elastic is gone, it's never going to go back. So if you want to avoid these sorts of injuries that do cause a lot of pain, if you want to look after your ligaments, you actually have to stop stretching them. So stop standing at the end range of your joints. Sometimes you'll see people who have what we call banana legs, so hyperextended knees, or maybe elbows that twist around. That's indications that your ligaments are quite lengthened. So I'm going to show you a couple of exercises that help with really honing in on your pelvic floor and your deep abdominal muscles, your transversus abdominis, and your deepest spinal stabilizer, your multifidus. It's really simple. Just destabilize your body so it has to work harder with the muscles to keep you in a neutral position. And once you then stand up against gravity, you'll find that the muscles start to come into their own when you're not even aware of it. So the first tool we'll use is an overball or a squashy ball, we call it sometimes, and half deflated, so you prop your pelvis in the indentation. So I'm going to pass it over to Kaya. She'll lie down on her back with her knees bent up in constructive rest. And it's always a good idea to do a couple of pelvic clots to make sure that you start in your neutral, which is where your two hip bones and your pubic bone are on the same plane. And if you have been overworking your ligaments, it will feel a little bit uncomfortable when you first lay on there. So you have to settle into it. So a couple of breaths. You know, we all love here at Tensegrity to get you to breathe well. So inhale, expand the side and the back of the ribs. You're going to let your belly expand. And then exhale slowly without too much force or contraction to engage your pelvic floor. That's where Kaya has gone into a posterior tilt. And then she'll come back into an anterior tilt. But you might want to do a couple of breaths where you don't move at all, then you can start moving. So just show them a breath where you don't do any movement, in the bones that is, only in the muscles. And I can see just above her pubic bone, it descends and there's a little bit of firmness in the musculature. So I know she's activating her transversus. Now she's going to do a couple of pelvic clocks. So a couple, I mean posterior, anterior once, posterior, anterior, twice. And now she's in neutral. We're going to make her be destabilized a bit more. We're going to do a single knee float. So inhale. As you exhale, really sink your sacrum down into the well of the ball. She's got a really nice 90 degrees of flexion at the knee and 90 degrees at the hip. She breathes in here, puts a little bit of pressure on the foot that's on the floor, and exhale, lowering down, anticipating the move so she can get 2 feet evenly placed in the center. She inhales, then exhale, take up the other leg, She has to work to stabilise through the leg that's on the floor now, and she's really mindful of her sacrum being the most prominent part sinking into the ball. And lower it down. Then we build it up for more stability, and that will be double legs. So we inhale, exhale, float up one leg. Inhale, exhale, float up the second leg. Inhale, exhale, float the second leg down without moving this leg, that's the challenge. And then inhale, exhale, take that first leg down. Then we would come up with the opposite leg. So she'd take the right leg up. Inhale, exhale, inhale, exhale, take that second leg down first. Inhale and exhale, and she's keeping her shoulders relaxed, reaching through her arms and ensuring that the back of her shoulders and the back of her arms are providing a little bit of support. How's that feel?
Yeah, good. Very much work.
Lots of work in her abdominals. The other way is you might have some air-filled balls. There are lots of them on the market, nothing too hard. So I'm going to ask her to roll off. You never just lift off when you've done this work. She takes the ball out and then observes how much more her sacrum feels relaxed onto the mat. So she's not gripping with the ligaments. She's actually using her abdominals. What do you think?
Yeah, definitely.
So now we're going to place one either side. So one on this side and one on that side of the sacrum. So these are our SI joints, our sacroiliac joints. So one in each hand, lift your pelvis off the floor. Now these seem really simple and many of you know them, but how many of you practice them daily to keep your body in tip-top condition if you've got that tendency for hypermobility or ligaments that are a little bit extra stretchy? So we're going to bring your pelvis a bit this way. That's it. Now does that feel comfortable?
Yeah.
She's got them in the right spot. Sometimes people put them too low and then it means can you just show them the posterior tilt? If they're too low, the body can't go to neutral and it tucks up like that. If they're too high, then you have the opposite where you're too arched in the back. And that looks pretty good. You can feel the groove either side where your SI joints, the central part of them is. And so from here, you can do the same exercises that we just did, and we're going to do knee tag. So we inhale and exhale to laterally rotate the left leg while not moving the right one. Inhale there and exhale using her adductors to bring the leg back, and she's having to stabilize in her internal obliques on the opposite side. Inhale, exhale, take the right leg out to center. She wants to keep lengthening this leg and putting a little bit of pressure down through the foot. Inhale and exhale, come back in. You would do that 6 times, 3 times each way. Now we're going to go into knee tag with 2 legs. So first one comes out, exhale. Inhale, pause. Exhale, bring the second leg out. So they're actually both oriented towards me on a diagonal. But you do have to work harder on the internal oblique on the opposite side to keep it anchored. And then inhale, bring them both back at the same time. One more. Exhale, opens that right leg. Inhale, exhale, the second leg goes over. And here you'll see we have to really get her to work on this internal oblique activation to stop her from tipping over. And inhale, back to center. So when you do that exercise, you want to feel that your sacrum and your whole pelvis is like a bowl of water. So if I take one leg out to the side, I don't tip any of the contents of the water out. So I would say you do 10 knee floats, some double knee floats, then go into your knee sides and your toe taps. Could do toe taps, but knee tag, and that will help get good stability through your core, your spine, your lower abdominals. Thank you.